This is Thursday, June 15th, 2011. I'm at Moscone Center, Howard and 1st Street in San Francisco. There is a healthcare industry, insurance industry convention here today, I believe. And there is a group here protesting this insurance healthcare industry convention. The way healthcare is delivered in the United States through the insurance companies always. It's single payer. Kind of like they have in Canada and England and most of Europe, where everybody has healthcare instead of just.
And they are here. These are the people who raise our rates. These are the people who refuse us health care. Health insurance is for the healthy. God forbid you get sick, because then they start denying coverage. We have a bill. It is SB 810. It is authored by our very own Mark Leno, bless his soul. It includes medication, it includes health care, it includes dental, it includes podiatry, it includes eye care, and I think it even includes mental health, which I need a lot of help with. And this plan is the right plan, the good plan, the just plan, the moral plan. But let's not talk about that. This plan will save California money. It won't just save you money. It will save your state money. It will save the school district's money. It will save the city's money.
And corporations.
It will save corporations and small businesses money. Because it will take out the insurance companies. It will just be health care. And that is the answer to the question, do we have a bill that will cover all of us for everything? All righty. So I am going to go right to our speakers because I think that's an important thing.
Thank you very much. It's a pleasure and an honor to be here representing the thousands of physicians and other health professionals in California who have organized into Physicians for a National Health Program. We who have worked in the trenches understand that insurance companies are not necessary to provide people health care. In fact, they don't provide any health care at all. The insurance companies have arisen as a way of helping to finance health care so that somebody pays your bills. And I can tell you that the majority of doctors in this country are on record as being in favor of a government-run national universal health care system. Unfortunately, many of our politicians are not leaders. And we had people who claim to be leaders who led us into the direction of basically guaranteeing that more of our income would go to the insurance companies who would waste our money. What kind of leadership is that? They will lie, cheat, and steal to keep you from getting single-payer health care. What are you going to do in return? Organize!
Listen, brothers and sisters, this is such an important issue. Our biggest issue has to do with jobs, but the biggest overall issue has to do with health care. And the group of people that are inside this building right now are not helping us, are they, brothers and sisters? I finished yesterday participating in some bargaining with some employers and with some unions. We spent 3 hours bargaining. Guess what the most important issue was? Healthcare. What was the most important issue? Healthcare. Luckily, because they were working under a collective bargaining agreement, we ended up with what we call a maintenance of benefits. So that no matter what these knuckleheads inside the building are doing, for the next 5 years, this group of employees is not going to have to worry about their health care because the employers are going to pay for it. But Is it fair to the employers to wake up every year and wonder what the heck they're going to have to pay because the guys inside the house here are going to raise the rates no matter what the hell is happening with no regulation?
No!
This is a crime that we have to pay so much for health care, that we are denied health care, and that we have the situation that we're in. Single payer now! Single payer now! Single payer now! Single payer now!
Tom Amiano is in Sacramento today fighting the good fight. But he wants you to know that every person in this country, regardless of race, gender identity, age, disability, or legal status, has a human right to a quality, affordable health care in this country. But I'm here to tell you today that there is hope. We have in California SB 810 that provides universal health care for every single resident in the state of California. And I'm here to tell you today that Tom is with you, and he tells you that we need to work in coalition with people that are different than we are. We need to work together, and together we will pass single-payer health care.
It is immoral for anybody in the medical profession to be denying health care to people just because they're getting the incentive and they're being paid so that these health care companies will save money. It is immoral.
Yes.
Yes. It is immoral for government, especially elected officials who have been entrusted to take care of people in our communities, to be in cahoots with these agencies, with these companies that make profit out of our health.
Yes.
It is immoral, even for those in our communities, to be apathetic to the situation of other people. For maybe today you're healthy and tomorrow you'll need that health care. It is immoral to be silent in this issue. My friends, we live in very difficult and precarious times, scary times, when big companies are making big profits out of what we need. While we live in dangerous and precarious times, when our rights are being taken away, sadly not just by these private corporations, but the government that we elected, this is also an opportune time for us to organize. Every opportunity when rights are being under attack, when workers and community are being under attack, we cannot be silent. Now is the time for us to organize. We should take this opportunity to go down to our communities, talk to your neighbors, tell them that you need health care. Talk to people at work. Tell them to stand up for their rights and not just cower in fear. For when we are together, when these people inside know that the people will not shut up, they will listen to us. Only when we fight, they will not give in unless we ask for it. And we have that power in our hands.
Now, when you talk about things like health care, you're talking about something that's abstract for a lot of people. They're just so well all their lives that it's not important to them. And they don't really get to think about it. And then you hear about places like Libby, Montana. Libby, Montana, where they happen to be mining asbestos, and everybody in town has been getting sick. When the senator wanted to try to take care of them in Libby, Montana, what did he do? He turned to Medicare. They declared that the entire town and all the citizens were eligible for Medicare because it was a single payer. It was the only way to get coverage for absolutely everyone. If Max Baucus can do that in Montana for the citizens of Montana, that's what we must do for the citizens of California. That's what we must do for the rest of the citizens in the United States. Single payer is what every other thinking nation has come to in order to protect its populace. That's what we must also come to. It's a time for us. We have legislation that's moving. We have the movement on the ground with the people who are here. And so we all have to redouble our efforts. Most of us have been doing this for a while. We must continue the effort. We must get to single payer for everyone, health care for everyone, so that everyone can live out their lives in the best possible way that they can.
We're going to get it because we all, throughout the state, at this time of year, when legislators are termed out and new legislators are starting to run to replace them, we need to go to them and say, look, it's very simple. You support single payer, we support you, and you win. You oppose single payer, we oppose you, and you lose. It's that simple. We've been doing that in Marin. We need to do that around the state, not just every Democrat, where we're pretty successful, nearly every Democrat, but Republicans as well. And it will pass. The polls are in our favor. We keep getting more and more co-sponsors faster and faster, and we will get this. But that's not enough. We got to keep it. We have to inoculate ourselves against the $100 million or so referendum, which we know is coming from these folks. So we have to educate person by person, door by door, to make sure that we do not succumb to their arguments when we have to defend this after it passes. Hopefully that'll be sooner rather than later. Hopefully we'll get a new study sooner rather than later to make sure that we can demonstrate that single payer saves money at every level. So it should appeal to conservatives as well. We all know that. Why don't they? We all know that SB 810, our single payer bill, provides better health care for everyone for less money. We all get that. Why don't they?
If you're sick, you can't go to work, you can't go to school, or effectively care for yourself or your family. Healthy people are our country's greatest natural resource. Today's protest in the USA is at the Moscone Center. Inside, the enemies of the People's Health Plan, Medicare For All, are holding a convention. Inside, America's so-called health insurance plans are plotting their self-serving and secretive special interests, profits before people plans to privatize and destroy our Medicare. It's okay. Inside, their minions of middlemen and corporate lobbyists are devising new ways to tighten their control over a system that protects their wealth at the expense of our health. We are one nation. We deserve one plan. Everybody in and nobody out.
Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out.
So tell me what democracy looks like.
This is what democracy looks like.
Tell them what democracy looks like.
This is what democracy looks like.
Thank you very much.